What is the most critical prognostic factor for a biopsy-confirmed primary cutaneous malignant melanoma? The Breslow depth, thickness of the tumor in millimeters, which dictates surgical excision margins and sentinel lymph node biopsy utility. A patient presents with a pearly, translucent papule on the face with telangiectasias and a central ulcer. What is the diagnosis? Basal cell carcinoma, BCC. What is the preferred oral antiviral timeline for a patient presenting with an acute herpes zoster, shingles, outbreak? Administer valacyclovir or famciclovir within 72 hours of rash onset to reduce the duration and risk of postherpetic neuralgia, PHN. What is the first-line treatment for a patient with tinea versicolor presenting with hypopigmented macules that scale when scraped? Topical selenium sulfide or topical azole antifungals. Oral ketoconazole should be avoided due to hepatotoxicity risks. What baseline monitoring is required before starting oral terbinafine for a patient with severe onychomycosis? Serum liver function tests, LFTs, due to the risk of drug-induced hepatotoxicity. What is the preferred oral empiric antibiotic for a patient with purulent cellulitis or a cutaneous abscess suspicious for MRSA? Trimethoprim sulfamethoxazole, TMPSMX, or doxycycline. A patient presents with well-demarcated erythematous plaques covered with silvery scales on the extensor surfaces of the elbows. What is the first-line treatment? High-potency topical corticosteroids, e.g., clobetasol, often combined with topical vitamin D analogs. A patient develops a single 3 cm herald patch on the trunk, followed days later by a diffuse symmetric eruption along skin cleavage lines, Christmas tree pattern. What is the management? Pityriasis rosea. Management is supportive/reassurance. It resolves spontaneously in 4 to 8 weeks. What baseline lab tests must be checked and monitored for a female patient starting oral isotretinoin for severe nodulocystic acne? 2 negative pregnancy tests under the iPledge program, baseline LFTs, and a fasting lipid panel. A patient presents with facial flushing, persistent erythema, and telangiectasias across the nose and cheeks triggered by hot drinks and alcohol. What is the diagnosis? Erythematotelangiectic rosacea. First-line topical management includes metronidazole gel or brimonidine. A patient develops painful, targetoid lesions and oral mucosal erosions 10 days after starting allopurinol. Less than 10% of the body surface area shows epidermal detachment. What is the diagnosis? Stevens-Johnson syndrome, SJS. If skin detachment involves greater than 30% of body surface area, it is toxic epidermal necrolysis. A young woman presents with painful, tender, bilateral erythematous nodules on her anterior shins following a bout of strep throat. What is the diagnosis? Erythema nodosum. Management is supportive with NSAIDs and treating the underlying cause. A 65-year-old male presents with tense, pruritic bully on his trunk and limbs. Direct immunofluorescence shows linear IgG deposition along the basement membrane zone. What is the diagnosis? Bullous pemphigoid. Pemphigus vulgaris features flaccid bully, oral lesions, a positive Nikolsky sign, and intraepidermal cleaving. A patient presents with intense nocturnal pruritus and linear burrows in the interdigital webs of the fingers. What is the first-line treatment? Topical permethrin 5% cream applied from the neck down and washed off after 8 to 14 hours. Repeat in 1 week. Treat all household contacts. A patient presents with a sudden onset of smooth, circular patches of complete hair loss on the scalp with exclamation point hairs at the margins. What is the first-line treatment? Intralesional corticosteroid injections, e.g., triamcinolone acetonide, for localized alopecia areata.